Hi, I'm Sabrina.
And I'm Gina.
Mitosis is a very important process in many organisms. Mitosis is composed of 4 stages in which cells asexually reproduce by splitting. These stages include prophase, metaphase, anaphase, and telophase.
Mitosis is especially important for bone growth. Cells split in growth plates which are located at the ends of a bone. The growth plate in the picture is at the top in brown. A growth plate is composed of soft cartilage which is weaker than the surrounding bone and ligaments.
As we said before, the length of the bone increases at the growth plate, also known as the epiphyseal plate. The area highlighted in red is the growth plate. Now let's take a look inside the growth plate in the juvenile vertebrae and how it develops into an adult vertebrae. The cells in the growth plate are called chondrocytes. The bone grows when the cells divide and expand. You're about to see the nucleus divide. The nucleus is the orange circle in the middle of the cell. Once the nucleus divides, the whole cell splits in two. Then surrounding cells also split. This is an example of mitosis. As the cells divide, the cells farthest from the surface of the bone begin to harden into bone.
This action is regulated by vitamins A and D. Without these two vital vitamins, your bones would be very weak. They would also break very easily. When the process is over, the juvenile vertebrae is full grown and the chondrocytes stop dividing. When you stop growing, you have adult vertebrates.
Do you notice anything different about this picture? Well, you should. Look at the girl on the left. When looking at the picture, her right leg appears longer than her left. The reason for this is because she most likely fractured her growth plate. Before the bone's growth is complete, the growth plates are susceptible to break or fracture. An adult whose bones have finished growing might simply pull a muscle or tendon after a fall, but in a child, that same fall could not only injure the muscle and tendon, but also the growth plate.
There are 5 major types of growth plate fractures, which are also known as Salter-Harris fractures. Transverse fractures through the growth plate are shown in Image 1. Image 2 shows fractures through the metaphysis and growth plate. Fractures through the epiphysis and growth plate are shown in Image 3, where Image 4 shows fractures through the epiphysis, metaphysis, and the growth plate. The final image shows a fracture through the growth plate, which is a compression fracture.
The risk of growth problems is related to the type of growth plate fracture, the amount of force that resulted in the fracture, which bone is injured, and the age of the patient. The more force to cause the fracture, the more likely the bone will stop growing. Some growth plates are much more sensitive to injury than others.
The reason that a growth plate fracture can be so dangerous is because, for the period of time that your growth plate is fractured, the cells stop dividing. In the long run, you can end up like the girl in the picture, with one leg longer than the other. This can affect daily activities such as exercising or playing sports, and when you go to run, you may feel awkward and unbalanced.
In conclusion, bone growth and mitosis work together in unison to help juvenile bones grow big and into adulthood. When one fractures their growth plate, it can result in much pain as well as the inability for bone growth to occur.
Now you know the process of mitosis, which causes bone growth, and how a fracture of the growth plate can affect one's everyday activities.
Thank you for watching!